my belief and what our research is going to be testing is that the benefit of attention practices are not limited to mindfulness-based practices or meditation. And what we've found is that for a large number of people who've survived complex and even non-complex, meaning single event traumas, they have a lot of trouble meditating because their system is in such a state of high arousal that what happens when they try to settle down is they have flashbacks or they dissociate. And I've actually talked to meditation center directors like Joan Halifax or Jack Kornfield about this, who've agreed that for some people, meditation is used to dissociate, which is obviously the opposite of what its intention is. And so for those people, the good news is that you can learn stabilization skills like ours as a preliminary part of having a meditation practice, so that from within your resilience zone, you're capable of sitting on a cushion or sitting in your chair and having a practice. And, you know, there's a woman, Elizabeth Stanley, who's done a combination of mindfulness-based practice with stabilization skills like ours. And she's had great success working with Marines and so forth on before they go into combat. So more and more we're seeing sort of hybrid models of mindfulness practice that include on the front end stabilization skills.
And one of the things that really strikes me about what you're saying too, which is maybe interesting in terms of working with men, is a kind of relanguaging of things, so whereas like mindfulness meditation may not immediately appeal, but calling it something else, kind of, that's a bit more direct, is probably much more helpful. And that it's very technique orientated. It's something to do. You go and do X, then Y, and so there's a kind of a clear, educative, and straightforward way of doing something.
That's a good point, and because in our model, the focus is not on talk, and the focus is not on insight. And it's one way that men, especially sort of left brain dominant men, which is a number of them, can, by doing that kind of talk, they keep themselves from the neck up and not from including their body. My feeling is that mental health, eventually we'll have a different word for mental health, because it should be mind-body health or something like that, even though someone told me the other day who works in a New York City agency that was way too woo-woo a word. But mental health implies that it's just in the head, and yet we know that what happens when the brain senses threat and fear is a whole cascade of things happen that affect almost every organ in the body, which is why a lot of people feel it's more acceptable to present with physical symptoms than emotional symptoms or something like that. So when men are helped to learn skills, like you're saying, tangible skills they can do, but they're also skills that are connecting them to their body and allowing them, encouraging them to use their signals from their body as very important information in their decision-making processes. And it's very compatible